Hi, I'm Radhika Sundararajan. I'm delighted to speak to you today about our work. I have no conflicts to disclose. So in sub-Saharan Africa, we know a major barrier to HIV epidemic control is the low rates or uptake of HIV testing. This is particularly true in rural Uganda, where it's estimated that only about a third of sexually active men are aware of their HIV status. In these same areas, traditional healers are commonly a healthcare resource. And it's been suggested that collaborating with healers could be a strategy to increase uptake of HIV testing. With that in mind, we designed a community-based point-of-care HIV testing program delivered by healers to their clients using oral swab HIV test kits. We evaluated the effectiveness of this program in a cluster randomized control trial. Traditional healers and their clients were randomized either to an intervention arm with point-of-care HIV testing or a control arm with referral for HIV testing at nearby facilities. This map shows the distribution of clusters across the landscape of nearby to Mbarara Township. Primary outcome for this study was an individual client receiving an HIV test within 90 days. Secondary outcomes were new HIV diagnoses and linkage to care for those newly testing positive. Here you see eligibility criteria for both traditional healers and their patients. Importantly, patients were eligible if they had not received an HIV test in the past 12 months and not previously diagnosed with HIV infection. Here is a schematic showing enrollment and randomization. We had 25 traditional healers practicing within the predefined location. 17 were randomized, 9 to the intervention, 8 to the control. Approximately 500 patients were screened for eligibility in each study arm, with 250 participants enrolled ultimately per study arm. Here are our results. In the intervention, we had 250 participants. That's 100% of all intervention arm participants receiving an HIV test. That's compared with 57 participants, or 23% of control arm participants receiving an HIV test. That, of course, is a 77% increase in the HIV testing uptake. This graph shows enrollment per cluster in black and HIV testing uptake in red per cluster, and then shown by study arm. 10% in the intervention participants were diagnosed with new HIV infection. That's 4% of all tests that were delivered by healers. 7% of these individuals were linked to HIV care at 90 days. There were no new cases of HIV identified in the control arm. In conclusion, we believe that delivery of point-of-care HIV tests by traditional healers to adults of unknown serostatus can significantly increase the uptake of HIV testing in rural Uganda. And specifically, we think this holds promise for increasing HIV testing engagement throughout sub-Saharan Africa, particularly where we know that conventional biomedical outreach has had limited impact. We have a lot of people to acknowledge, and thank you for your time.